In 2007, 9-year-old Hubidia Iderisu faced long days of pain as 3 guinea worms began to emerge from blisters in her body. Hubidia was the victim of a particularly severe guinea worm disease outbreak in her town of Sivalugu, Ghana. I probably caught the worms when accepting a drink from my neighbor during my rounds of charcoal selling, she said. Inside her abdomen, the larvae she ingested matured and grew up to a length of 3 feet or 1 meter. As they matured, they migrated through her body, following the connective tissue down to her legs and feet. After a year, the thread-like guinea worms slowly emerged through blisters in the skin to release their eggs. Every day, a volunteer came to Hubidia's home to extract the worms. This was done by coaxing the worm from the body by exposing it to water. Then the worm peeked out from the blister. A doctor or family member would carefully wind the worm around a stick a little bit each day. In Hubidia's case, this took 2 weeks, but for others, it could take as long as 2 months. Often, people suffer from more than one worm at a time, like Hubidia. The incapacitating wounds caused by the worms typically take up to 2 months to heal. While the worms were emerging, Hubidia was unable to attend school, handle her household tasks, or work at her after-school job. A year later, Hubidia is free from guinea worm disease. She is able to carry out her daily chores as well as her job selling charcoal to help support her family and pay for her 3 siblings' school fees. She is a bright student who gets high grades despite her long hours of work. Hello everyone and welcome. My name is Dr. Jeremy and I am the Everyday Epidemiologist. Today we're going to talk about Dracunculiasis or guinea worm disease. But before we get into that, a few quick disclaimers. First, I am not a medical doctor. Nothing in this video is medical advice. Any medical advice you want or need should be obtained from your physician. Second, this information is being brought to you by me alone as someone who knows a bit about public health. It is not coming in any sort of official capacity from the health department I work for. Third, all of the information provided in this video comes from publicly accessible websites, books, and research articles. The sources will be in the description of the video. Fourth, I will try to provide as accurate and scientifically based information as possible. However, I may misspeak or say something that is incorrect. If you catch me on this, please leave a comment with what I said wrong, and if possible, a source to the correct information, and I'll look into it. If I was wrong, I will provide the correct information in a future video. Fifth, there will be pictures of people with the infection. Some of these can be fairly graphic. I will warn you before I show any of these pictures and tell you when I've taken them down. If I forget to do this, I'm sorry. I'll stop periodically throughout the stream. However, feel free to type any questions you have in the chat at any point and I will answer them as I see them. If you are watching later on the VOD, please leave your questions in the comments and I will answer them as soon as I can. Lastly, before we proceed into guinea worm, I have an answer to a question from the smallpox video 2 weeks ago. The question was, why was the bifurcated needle used for the vaccinations as opposed to the more traditional hypodermic needle? I suspected it was just determined to be the cheapest and most effective method, but I found a better answer. The bifurcated needle was developed in 1961 to be a more efficient and cost-effective alternative. This was in part due to the fact that it required only 1/4 the amount of vaccine. Additionally, this method of administering the vaccine was simpler than other methods available at the time, so it's easier to train and easier to deliver. Thank you to those that sent me additional information about this and started me on a deeper search to find the actual facts. So, without further ado, let's get into guinea worm disease. Throughout this section, there will be pictures of infection, and I will let you know when these pictures are taken down. People typically don't have any symptoms of guinea worm disease until about a year after becoming infected. This is because the incubation period ranges from about 10 months to about 14 months. During that time, everything appears to be business as usual. When symptoms do appear, they present as a blister or blisters on the lower limbs and frequently the feet, as you can see in this picture. This blister can be fairly large, measuring several centimeters across, and appears to be filled with a clear fluid. Frequently, when the blisters appear, and sometimes a little bit before, the area of the blister has a burning and or itching sensation as well as pain and swelling. This is where it gets the name the dragon worm or the fiery serpent. Sometimes other symptoms occur, including fever, nausea, vomiting, diarrhea, dizziness, swelling of the eyes, and joint pain. These symptoms can be quite debilitating and can prevent people from working or attending school. When blisters become exposed to fresh water, they rupture and the worm inside emerges partway to release the next generation of larvae. Other than that, there really aren't many symptoms or bad outcomes from guinea worm disease. However, the rupture blister can become infected by a bacteria, leading to some potentially very serious complications. This can include arthritis or inflammation and pain of, I can speak. This can include arthritis or inflammation and pain in the joints, synovitis or inflammation of the membranes lining the joints, ankylosis or where the bones fuse together, and contractures or the shortening and hardening of muscles, tendons, and ligaments. Additionally, tetanus infections can occur at the lesions. These secondary infections, especially tetanus, can be life-threatening. Luckily, with proper cleaning and maintenance of the wound, these secondary infections can be limited or even prevented. And the pictures have been taken down. So at this point, I know it's pretty quick. A quick run through of what guinea worm is, or at least what guinea worm disease symptoms are. But that's about it. So I'll stop and see if anyone has any questions about guinea worm at this point. Anything about the story, anything about the symptoms, anything else. I'll be covering other aspects of guinea worm shortly, but if you have any questions, go ahead and throw them in the chat and please let me know. I'll wait here for a minute or two to see if anyone has any questions. In the meantime, I will mention where guinea worm exists. I do talk about it a little bit later, but this is, well, when it was originally, it was in like Asia, especially like South Asia and Africa, particularly sub-Saharan Africa, but through various public health efforts that I'll talk about more later, it's down to just a couple of countries in Africa. But I'm not seeing any questions at this point, so without further ado, I guess let's move on. So what causes guinea worm disease? Oh, that didn't go where I wanted it to. What causes guinea worm disease? How do you catch it? And how is it spread? Guinea worm is a parasite, and as the name suggests, the causative agent is a worm, but probably not the kind of worm you're thinking about. This type of worm isn't like an earthworm. It's a nematode or a roundworm. The scientific name for this worm is Dracunculus medinensis. A parasite is an organism that lives on or in a host organism and gets its food from and oftentimes at the expense of its host. The three main classes of human parasites are protozoa, which are microscopic one-cellular organisms, helminths, which are large multicellular organisms, the worms, and ectoparasites, or blood-sucking arthropods, such as mosquitoes. Dracunculus medinensis is a helminth. Dracunculus medinensis has a fairly complex life cycle and transmission cycle. When an infected person or animal has a lesion, as I mentioned, they often have a burning sensation. The patient sometimes puts the affected area into water to relieve that pain. This allows the female worm to expel thousands of larvae into the water. These larvae are then eaten by tiny crustaceans known as copiopods or water fleas. Over the next 2 weeks, the larvae grow and develop into the infective stage while in the body cavity of these copiopods. Then someone or some animal will come along and drink the water without boiling or filtering it, thus ingesting these infected copiopods. The stomach acid will kill the water fleas and allow the worm larvae to be released. The larvae then migrate through the intestinal wall and into the abdominal cavity. After about 100 days of growth and development, the males and females will mate. The males will then die, and the females will move down to the feet and lower limbs, following the connective tissue. Then, about a year after being ingested, the pregnant female worm emerges in a blister and starts the cycle all over again. So, yeah. So that is guinea worm disease. That is how it spreads. That's how it reproduces. The picture here shows that life cycle. But what treatments, if any, exist for guinea worm disease? There is a picture of the infection coming. Unfortunately, there is no medication to treat guinea worm disease. The only way to treat it is to wrap the worm around a small stick and slowly pull it out a few centimeters, an inch or so, per day. This could take days, weeks, or even a month or two because the worm can grow up to about a meter or 3 feet in length. Sounds pretty miserable, doesn't it? This process can be quite painful. The reason you only get a few centimeters each day is you don't want to risk breaking the worm and having part of it stuck in the body. While extracting the worm, the wound is treated with topical antibiotics and covered to prevent secondary infections. I have taken the picture down and I'll stop now again to see if there are any questions at this point. Anyone have any questions about guinea worm disease? Not seeing any questions at this point, but I'll give it another 30 seconds or so, see if there's anything there. Whisper says that it's kind of scary that there aren't any medications available to terminate that worm. I mean, yeah, but there's a lot of things out there that we don't have treatment for, unfortunately. Um, but again, luckily, other than the secondary bacterial infections and the pain associated with the blisters, there aren't that many symptoms. There aren't really negative outcomes. As long as you don't get a nasty secondary bacterial infection, guinea worm disease isn't going to kill you. And once the worm releases its larvae, it'll die, and you're fine. So that's probably why there really wasn't a whole lot of big push to get a medicine to treat it. Also, guinea worm disease is what's called a neglected tropical disease. Neglected tropical diseases are just what the name suggests. They are tropical diseases, typically occur in low and or middle income countries. Think Central America, some of South America, Africa, Sub-Saharan Africa, Southeast Asia, countries that don't have a ton of money for medical treatment, or so-called first world medical treatment. And since they don't occur in the highly developed countries, Europe, North America, people in those countries don't really care or think about it or work on it. So there isn't a whole lot of money working towards the treatment or prevention or cure of these neglected diseases. But we will talk a little bit about guinea worm disease and why it's a bit less of a neglected disease over the past couple of decades. But yeah, there's just I don't know if there was just not a lot of push for getting a medicine, or if it was just difficult, or both. But yeah, luckily it wasn't really needed, and you just got to pull the worms out. But that is pretty nasty way to treat the disease. But hi, Crumbs, welcome. What is the lifespan of the worm? Will they reinfect the hosts, as in their larvae remain in the host immature? So no. I don't know the lifespan of the worm. Let's see if we can find that. I'm curious. Let's see. Once it releases its larvae, I don't know how long it lives after that. All right, so the duration of the emergence. So once it emerges to release the larvae, that happens for about 1 to 3 weeks. Oh, let's see. I'm not seeing life history of guinea worm. Let's see. Let's see what this says. Okay, so 12 months to reach maturity. Yep. Okay. Okay. Okay, so this is the life cycle of the copiopods. Infected copiopods, infected sandworms, usually die after about 6 weeks of being infected, but that's not what I'm really looking for. I'm looking for, how long it lives in humans after releasing. So yeah, again, the males die after fertilizing the females. And it takes about 6 months for the female to find the site to discharge the larvae. It doesn't say how long the female lives after it releases the larvae. I would imagine it probably doesn't live very long afterwards. Because it can't reproduce anymore at that point, so there's no real reason to continue its life after that. But yeah, I'm not sure. I'll see if I can find more information after the stream, and if I find more, I'll put a comment on the video. But will they reinfect the host? As in, their larvae remain in the host and mature? No. So again, I'm gonna put a picture of the infection up on screen. So when the worm emerges, it spits the larvae out into the water. The larvae do not stay inside your body. The larvae want to get in the water so that you can drink the water with the infected copepods. So no, the body does not get reinfected by the larvae, other than if you drink the larvae again. All right, I've taken the picture down of the infection. Sarah's decided to get stuck on the thumbnail. Sorry to hear about that. But if there are no other questions at this point, so the female dies after releasing the larvae, I would assume so. I don't see any information about that in what I just found or what I saw earlier, but I would assume that the female does die after ejecting the larvae. And the male dies after mating. Yes, that is correct. So it's a pretty well balanced worm. Not too OP. No, it's not. It's not too OP. It's not too bad. Not too bad. Still a pretty nasty disease that I mean you don't want, and you want to try to get rid of course. But yeah, if there are no other questions, which I don't see any at this point, let's go ahead and continue. So, what preventative strategies exist for this nasty disease? Oh, wrong picture. Sorry about that. The prevention plan for dracunculiasis is twofold. The first and main strategy is to prevent people from becoming infected in the first place. This can be accomplished by providing access to clean drinking water. Water filters are good for this. A fine mesh cloth or a pipe filter effectively removes potentially infected copepods from the water that you are trying to drink. If you don't ingest the copepods, you can't ingest the worm larvae, and can't become infected. Yeah, boiling water before drinking it seems like a good idea. Absolutely. Boiling it or filtering it. Yeah, as I was about to say, you beat me to it, Captain Crumbs. Boiling the water can also kill the water fleas and the worm larva, making the water safe to drink. Drinking water can also be treated with Timophos. I think it's pronounced Timophos, to kill the water fleas, thus interrupting the life cycle of the worm. Both is, I mean, always a good option. Filtering it can remove, depending on the size of the filter, of course, can remove various other things, and boiling it can kill things that the filters don't remove. So yeah, I mean, both can't hurt. But for guinea worm disease particularly, both are not necessary. One works. The second method is to prevent the worm from infecting people and animals. Sorry. The second method is to prevent the worm in infected people and animals from releasing the larvae into drinking water. To do this, the affected body part can be placed into a bucket of water, allowing the worm to eject the larvae. This water will then need to be kept away from any drinking water and buried in the ground to prevent any accidental infections. Lastly, okay, I guess it's more of a threefold prevention plan. Since infection can occur by eating aquatic animals, properly cooking or curing any food animal that comes from potentially infected waters can stop the infection. Well, I guess that's more of a subpart of the first strategy of preventing infection, isn't it? So yeah, I guess twofold. Yeah, I guess that works. But can we eradicate this disease like we did smallpox? The short answer, yes. The longer answer, we're working on it and getting very close. Snakes, Big Fat Snake says, yeah, or just drink whiskey or rum works too. I mean, that introduces a whole other range of issues, but I mean, yeah, I guess you're not going to get infected by guinea worm disease if you drink whiskey or rum. Coffee would work if it's boiled water. If it's just heated water, but not to boiling where it will kill the worms and kill the copiopods, then coffee won't necessarily work. You gotta boil it. Gotta boil it. But eradication, as I said, we are working on it and we are getting very close. And this is how we are doing it. So shortly after the eradication of smallpox, in May of 1981, the World Health Organization, through the Interagency Steering Committee for the Cooperative Action for the International Drinking Water Supply and Sanitation Decade from 1981 to 1990, quite a name, proposed that the elimination of dracunculiasis would be a good indicator of success for the decade. Obviously, they didn't quite get there. That year, the WHO and the U.S. Centers for Disease Control and Prevention started formulating a strategy to achieve this goal. The Carter Foundation joined the Carter Center, I think it's actually called. Hold on a second. Let me double check this. Was it the Carter Center or the Carter Foundation? The Carter Center. I apologize. I got it wrong in in my script. The Carter Center joined the fight in 1986 and has since been on the forefront of the eradication campaigns. There are several strategies that have been and are being used to work towards the eradication of dracunculiasis. Villages where the disease exists are mapped and community-based surveillance systems are established. These surveillance systems work to identify cases as soon as possible and immediately report them. When cases are identified, containment strategies, including those I mentioned before, collecting and disposing of the larvae, are enacted. These surveillance systems include regular reporting even when there are no cases to report. This helps maintain the database and allows for better monitoring of the situation. Ensuring access to safe, clean drinking water and health education are the two main cornerstones of the guinea worm eradication program. Education is provided to those in affected areas and teaches them about how the worm spreads, what to do if you become infected, and what you can do to prevent becoming infected. However, making sure everyone has access to clean, safe drinking water is arguably the most important eradication strategy. As I mentioned, filtering the water through a fine mesh cloth or pipe filter can remove the copiopods and interrupt the infection cycle and stop people from becoming infected. Making boreholes and wells to get access to safe water is also an effective method in many areas. Well, the eradication campaign has been going on for about 44 years now. How's it going? How's it coming? What progress is being made? In 1986, there were an estimated 3.5 million cases of dracunculiasis in 21 countries across Africa and Asia. The first truly reliable number I could find was in 1989. There were 892,055 cases, human cases, not counting the animal cases. In 2024, there were 15 human cases in 2 countries, Chad and South Sudan. This is a reduction of more than 99.998%, which is huge. Animal cases also continue to drop year on year. In 2023, there were 827 animal cases in 6 countries: Angola, Cameroon, Chad, Ethiopia, Mali, and South Sudan. In 2024, that number had dropped to 662 cases, still in those 6 countries. So basically, we are so very close, but not quite there. All of these eradication campaigns, all of these education campaigns and prevention campaigns continue and will continue until there are no more cases. Now with that, what questions do you have for me about guinea worm disease or about the eradication process or progress or anything related to guinea worm disease? Are there any questions? Anyone got anything for me? Any questions? Any comments? Anything? Nope. All right. Well, I'm not seeing a whole lot of questions at this point, so we can move on. So, with that, with all of this information, oh, there is a question. How are they working on preventing the animal infections? That's a good question. That's a very good question. So the main way, I believe that one of the main ways that they're doing that is by preventing the release of the larvae into water. If the larvae don't get into the water, then it can't get into the copiopods and then can't be reinfected into the animals. I mean, you can't really filter the water that all the animals filter or boil all the water that the animals, especially like farm animals, cattle, sheep, goats, things like that, drink. So it's probably just the isolation and preventing the larvae from getting back into the water. It's probably the main strategy. But really the main goal, I mean, the goal is to get rid of the animal infections as well, if possible, but the main goal is to get rid of human cases. Whisper says, we will most likely never really eliminate dracunculiasis entirely, since aquatic life forms and animals can and will get infected and spread the worm. So the definition of eliminate, I guess it's kind of, we will eliminate human infections is the main goal. But I mean, it could get to the point where we could even potentially extinct Dracunculus medensis. I mean, if we stop the transmission cycle, even in animals, and kill off the copiopods, the water fleas in infected waters, then we could stop transmission into animals. It would be a lot harder to stop the transmission into animals, but it could be done. It could be done. Yeah, wild animals are obviously not going to stop drinking the water, and they're going to get infected. But again, if we halt the transmission, so I don't know. So on this map that I showed, so this is a little out of date, and it mostly shows human transmission. But these are the countries where guinea worm has or is still around. Again, mostly human cases, but I don't know, and I haven't seen any information in the searching about infection numbers in wild animals. Actually, let's see. I'm curious. Seems. Case. So this is where I got the guinea worm case numbers from the Carter Center. So again, here in 2024, there were 15 human cases, and so far, as of September 18th, in 2025, there were 4 reported cases. However, the official numbers, as it says, will come out in March of the next year. But here we've got the human and animal infections PDF. So this is, so in 2023, there were 14 cases, 2024, 15 cases, and this is really out of date for 2025. But these are the guinea worm cases in animals. 827 in 2023, 662 in 2024, and unofficially, at the time of this release, 195 animal cases. Now, I don't know where they get these animal numbers. I don't know if that's just like domesticated farm animals, pets, that sort of thing, or if they have some way to monitor wildlife, wild animals. I don't know. So I don't know what the case total is in wild animals. I'm not sure. I'm not sure. I will see if I can try to find that more information on that. But I'm guessing, as Whisper said, that these numbers are domesticated and pets, domesticated animals and pets. But regardless, if we can, again, the main objective. I mean, yes, we want to try to prevent animals from getting this because we don't want the poor puppies and poor antelopes and giraffes and cows and things to have this nasty disease. But the main goal is human eradication. No, not human eradication. Eradication of human disease. Hi, cat. Here's a kitty tail. The main goal is eradication of human infection. And that, again, we are close to doing. And if we continue with providing clean water, and if we get everyone access to clean drinking water, then there will be no more human cases. It is likely a disease, likely a worm that we will never extinct, but we can eradicate human disease and potentially, with a lot more work, but potentially eradicate all animal disease. Again, it would be a lot more work, it'd be a lot more difficult, but it might be possible. Whisper, yes, human eradication. Captain Crumb says, eradicating humans would stop the worm infecting humans. That is true. It would also stop, it would eradicate a lot of diseases if we eradicate humans. But that is true. But I'm not here to advocate the eradication of humans. Let's not do that. Let's not do that. But yeah, are there any other questions? Any other questions about guinea worm or about the eradication or anything else? No, I'm not seeing anything, so I'll move on. So with all of this, how worried do you need to be about guinea worm disease? Unless you are in or going to one of the few areas where it is still around, you don't need to worry at all. If you do go to one of those areas, as long as the hold on a second. Brandon asks, what color MTG card would the worm be? Oh, let's see. For those that don't know, MTG is Magic the Gathering. It's a card game. Let's see, what color would it be? Probably have to go with red. It'll definitely have some red. I'm trying to decide if it has green in it. So red because it causes a lot of pain and burning sensation. And it's also nicknamed the dragon worm or the fiery serpent. So I think red fits for there. Maybe green as well, with the life cycle, how it gets into the copiopods and humans and all that. And it ejects the larvae into water. Yeah. Yeah, I'd probably go with red and green. I think that would be a good thing for that. But as I was saying, if you do go to one of the areas still affected by guinea worm disease, as long as you drink clean water that has been boiled, filtered, or that comes from a bottle, you don't need to worry either. If you do live in one of those areas, if you happen to be watching this and live in an area where a guinea worm is still around, yeah, probably ought to be a little worried. Worry enough to remember to clean the water before you drink it. Worry enough to filter the water. Worry enough to boil the water. As long as the water you drink is filtered or boiled, and the aquatic animals you eat are properly cooked, then you won't become infected. So worry enough to do those things. Cook the water, treat the water properly, and cook the animals properly, and that's it. You're fine. There are, hey Chisel Chip, how you doing? First time catching a live stream here. Well, you're here right at the end, unfortunately, but yeah, thanks for stopping by. But lots of amazing epidemiologists, communication experts, healthcare professionals, and other public health professionals have worked and continue to work very hard over the past 44 years towards the goal of eradication. Thanks to their tireless work, we are on the doorstep of taming the dragon worm. Are there any last-minute questions about guinea worm disease, about how it's transmitted, about its life cycle, about the symptoms, about the eradication campaign and prevention methods. Any questions at all? It's a relatively short stream today, much shorter than last time with the smallpox, but the symptoms here were pretty straightforward. And honestly, the prevention strategies, pretty straightforward as well. Filter the water, boil the water, and yeah. Chisel Chips says, hope it went well. Thanks for bringing all the information. Great idea to bring to YouTube. Well, thank you. I appreciate it. Brandon says, might have missed it. How prevalent are they in North American mammals like raccoons, dogs, etc.? They are not at all. This disease is only in Africa. The 6 countries where it exists in either animals or people. So in people, it only exists in Chad and South Sudan. And in animals, it only exists in Angola, Cameroon, not Central African Republic, not for a couple of years at least, Chad, Ethiopia, Mali, and South Sudan. So it's not here, not in North America, only in those countries. So the prevalence in those in North American mammals is a big fat goose egg, 0. Yep. Don't have to worry about it up here, luckily. Any other questions about guinea worm disease? Is this a different guinea worm then? I'm not sure what you're thinking of. This is the only guinea worm I know of. The North American guinea worm. Yeah. Yeah, this is a different species. The guinea worm disease that I'm speaking of is Dracunculiasis metanensis. The ones in North America, are Dracunculus exignis and Dracunculus utre. Yeah, I actually didn't know this was a thing. It's a different one, yeah. Thanks for letting me know about this, though. This is interesting. So apparently, these in North America are fairly common, especially in raccoons. Dracunculus insignis is potentially is in some surveys is as high as 50% in raccoons and mink. Wow. And the Dracunculus lutre, that's supposed to be lutre, not utre, lutre, it's in 88% of river otters in Ontario. It's also in raccoon, mink, red fox, river otter, fisher, pine marten, short-tailed weasel, and muskrats. Interesting. Huh. Very interesting. Very interesting. Yeah, thanks for sharing about this. But luckily, this one is not, from what I can tell, in humans. I don't know if it can infect people. It might be able to infect people, but at least one nice thing is in North America, at least in most areas, we have clean drinking water, clean, safe drinking water, again, in most areas. Um, but yeah, so we can prevent humans from getting this. But yeah, very interesting. Very interesting. Thanks for sharing. I didn't know. Guinea worm stream part 2. Might have to. Might have to. Yeah. Might have to look this up and learn more about it. And there might be another stream about this in the future. Thanks for sharing. We'll see if there's what information I can find about it. Absolutely. Are there any other questions? Are there any other questions? That was a good one. I learned something new today. I like it. It's always nice when I learn something while doing the stream. I definitely learned a lot while doing the research for the stream. But it's always nice to learn something in the stream as well. Well, I'm not seeing any other questions, so I want to thank you all for joining me today. If there are any questions that I have not yet answered, please leave them in the comments and keep your eyes out for the next video, which will be about measles. I hope to have that out December 7th. Be sure to subscribe so you don't miss any of my videos or public health announcements, and follow me on Bluesky and Instagram, where I share lots of disease and public health information in between episodes. You can find the links to those in the description. Stay healthy, stay happy, and remember, public health is for the good of everybody. I'll see you next time.